Welcome to Oncology Revolution, where science meets care to transform the cancer journey. We explore evidence-based strategies to enhance quality of life, promote longevity, and empower patients and professionals to thrive beyond cancer.
Welcome to the Oncology Revolution Podcast. I'm Raquel Maris. I'm an occupational therapist with an executive MBA, and I'm working at the European School of Lifestyle Oncology. Today, we're thrilled to welcome Tyler Hussey, with a rich background in pharmacy and a growing presence in functional and lifestyle medicine. Tyler, welcome. It's truly a pleasure to have you with us.
Thank you so much, Raquel. I'm excited to chat with you today.
Would you like to introduce yourself a bit more and share about your professional journey?
Yeah, for sure. I've been a pharmacist for 12 years now. I'm in Salt Lake City, Utah, and the first half of my career I was in retail pharmacy, and then I transitioned into an infusion pharmacy role, so primarily chemotherapy and other IV medications, but mostly chemotherapy. So in my retail experience, part of that was at a cancer hospital. So I've been around cancer patients most of my career. In the last 6 years, really focused on oncology and chemotherapy. About 2 years ago, I dove into functional medicine and lifestyle and preventative medicine, and my eyes were really opened, kind of a whole new world. So I got really excited about that, and I started applying it in my practice. I would talk to patients about diet and lifestyle and exercise, and that was really good. I did that for a couple years, and it was hit and miss. The collaboration with the nurses and the team there. I don't think they stressed it a ton where I was at. So I actually recently had the opportunity to transition into a compounding pharmacy where we focus on hormone health. And so the last few months, I've been really diving into hormones and how they affect our health, and a lot of that into oncology as well, just because that's an interest of mine. So, and it's been very interesting, the things that I'm learning. So, so it's been kind of a wild journey, but here I am now. I'm really focused on more of the lifestyle, preventative medicine, which is really exciting to me.
Thank you for sharing your story. I would like to know what specifically drove you to lifestyle and functional medicine. Is there a story behind it or something that happened?
Yeah, for sure. I think it all started about 6 years ago. My sister actually passed away. She had a baby, and she passed away following that, which was really one of the hardest things that I've gone through in my life. So she, after she passed, it was a very transformative time for me. I started asking a lot of questions and started just thinking about things differently. And then COVID hit about 6 months later. So I was really had my eyes open. I was really reading the studies and really thinking about things. And it was a very, very stressful time in my life. Losing my sister, we moved, we had a baby. We just had a lot of stressful, big events in my own life. And I just felt off for a while. I was feeling burnout and just not feeling well. You hear about brain fog and just low energy and irritable, and was kind of a really hard time for me for a few years. So that kind of led me into just digging in. What is going on with me? Why don't I feel well? I had no idea. I kept going to the doctor, and they would run labs and they'd say, "Oh, you're young, you're healthy, you're fine." I got no answers. And I I wasn't happy with that. So I just kept digging and digging. And after a few years, I found functional medicine and started training in that and did some tests. And I found out that I was in adrenal fatigue and my hormones were all out of whack. And, I finally got some answers as to what was going on with me. So it was very personal, and I really dove into that, and it was super exciting to me. So I just started talking to everyone I knew. I started talking to family and friends, and a lot of people. I started to realize a lot of people had the same issues that I did, and a lot of people were interested in it, and it just kind of became a passion from there. I started doing some coaching and talking to patients about it at the hospital and different things. So yeah, very personal journey.
Well, thank you so much for sharing about your journey, and I'm sorry to hear about it. Um, well, what was the reaction of people when you first mentioned lifestyle and functional medicine? What were their reactions?
Yeah, I think family and friends were excited about it. They were very interested about it. But I did find at the hospital, people were less open to it. I started talking to patients, and I would go into new cancer patients, and I would just talk to them about sugar intake and fasting. And there were a few experiences that were just really eye opening to me. Like, first off, just kind of looking around the infusion center, and the treats that we were providing the patients were Oreos and chips and soda. And like, I'm just like, these cancer patients, this is the last thing that they need, is to come in here and binge on sugar. So I would go in and I would start talking to them, and I would say, hey, one thing that I always like to say is that our body is just as effective at fighting the cancer as the chemo is. So we need to make sure that our body is as healthy as possible. So, we need to be eating well. We need to be exercising. Fasting can be very helpful during your treatment. And I did have a few really interesting conversations. One patient, I kind of said, has a doctor talked to you about diet and limiting sugar? And she said, yeah, the doctor mentioned it. But then the nurse came in and she just said, yeah, go ahead and eat sugar, eat whatever you want, like it's not a big deal. And that was really frustrating to me because just to understand that everyone wasn't on the same page, that the nurse was saying something that contradicted what the doctor said. And I was really grateful that the doctor was having those conversations, but I didn't have a lot of collaboration with the doctors, so I didn't really know what was going on. But yeah, it was pretty frustrating to me to hear that the patients weren't getting great advice all the time.
Yeah, I get it. Let's dive into a bit about the role of pharmacists in oncology. We know that pharmacy can be so much more than most people traditionally imagine. Let's explore this context of oncology. What do you see as the pharmacist's unique contribution to cancer care beyond traditional role of dispensing and managing medication?
Yeah, for sure. One of the things that I think is unique about pharmacists is we are so accessible. Most people live close to a pharmacy. You can walk into any pharmacy and you can talk to a pharmacist um, pretty much any time, right? Like, so we are one of the most accessible healthcare providers. Um, a lot of the focus in training is on how the medications work, about side effects, about treating side effects. Um, so that's where a lot of our training was in school. But I do think as pharmacists, we are in a unique situation where we can educate, we can help patients understand their disease, understand not only how the medications work, but also how their body's responding to the medications, and things that they can do to make their body stronger and to help fight the medications better. So yeah, that's kind of what I'm exploring.
Yeah. Well, pharmacy as a profession includes many roles, right? From the community pharmacy, as you were saying, to hospital settings and the pharmaceutical industry. In your view, how does the role of a pharmacist differ in these different contexts? So, the community pharmacy, the hospital or clinical oncology team, the pharmaceutical industry or drug development setting. What is your perspective on the role of the pharmacy?
Yeah, for sure. So pharmacy is interesting here in the U.S. Because I don't know if they have this in other countries, but we have a residency program where they want to train pharmacists for 2 additional years to be able to work in a clinical or hospital setting. Um, and the second year is really focused on oncology. The first year is kind of more general hospital pharmacy. So an clinical oncology pharmacist in a hospital is going to have, a full additional year of training specific to oncology. Um, so as someone who didn't do a residency or a community pharmacist, um, I I wasn't as involved in the clinical decisions and rounding with the team, um, where someone who has done it, it seems like they want someone who's done a residency to be involved in those. There's kind of a disparity there. So in a community pharmacy, you may not have access to the notes. You may not have access to what's going on with the patient. So you have a little bit of a limited view of their situation. Where someone who's in the hospital, they'll be able to see the doctor's notes. They'll be able to know a little bit more what's going on. A lot of the time, they'll have a little bit more training. So, yeah, it can be a big difference. As a community pharmacist, it can be kind of challenging to know what's going on. You don't really know the history with the patient. You kind of just know what the meds are and you assume what's going on by what they're taking. And then I think the pharmaceutical industry is totally different. In the drug and development, they are trying to get new medications to market and to get them used and prove their efficacy and sell the doctors and things. So there's a lot of different roles in pharmacy that all kind of contribute to the patient's health. But yeah, a lot of different roles.
And which of these roles do you think holds the most untapped potential for supporting patients with cancer in a more integrative and or lifestyle-based way?
Yeah, I mean, I think definitely the hospital pharmacy can. I think that's where a lot of the initial education comes, and that can be a really powerful place for a person. I think when you get a cancer diagnosis, you are that's a very stressful time. That's a very important time to educate them and to put them on the right path. I think community pharmacists can also play a big role. We can, the community pharmacist is who you're going to see most often. So anyone in the community can interact and can encourage lifestyle. I guess it depends on the cancer too. Some people are going to be in the hospital a lot more, and some people, depending on your stage and how severe your symptoms are and things. But I think all pharmacists should keep that in mind for sure. It is such an important education piece, and we're just not trained on it. We're our focus of our training is on side effects and on the drug, but lifestyle is such an important aspect to health, and I think that we can do so much more as we include that in our education for patients.
Well, I completely agree. We have a free ebook with a quick guide on implementing lifestyle strategies for pharmacists. Well, let's dive into a bit into functional and lifestyle medicine. As you said, pharmacists they can serve as allies in educating the patients, so they are much more than just technicians. How do you personally define functional medicine?
So personally, I would define it as uh, getting to the root cause of what is causing disease or illness, and then addressing that root cause. So often in medicine today, we have specialties, and we don't look at the body as a full system. We look at it as different parts and pieces, and um, it's just kind of a short-sighted view. We miss the root, and a lot of the time we end up masking symptoms or treating symptoms with medications and just band-aids rather than getting to the root and actually helping people heal.
Yeah. Which lifestyle strategy do you find most impactful for people living or recovering from cancer?
Oh, most helpful. That can be. There are a lot of helpful things. I probably diet. I would say, just especially here in the U.S., most people eat such a horrible diet. We eat so much processed food and so much sugar that just feeds cancer. And so eating a whole food diet and cutting out the sugar and the processed foods plays such an important role for most people.
Yeah, I agree. And well, I'm based in Portugal, but I have been to the States a few times, and it's pretty easy to have a bad nutrition there. It's very accessible. The bad food, yeah, actually the fast food. In
Yeah.
your experience, what's the most underestimated lifestyle intervention in cancer care?
One that I'm really interested is fasting, actually. Um, when we fast, our body can get into apoptosis, and it can clean up bad cells, and it can really focus on the harmful cells. And so I think that's really underutilized. There have been some studies that show that people will have a lot less side effects when they're fasting, and they'll recover faster, and the chemotherapy will be more effective. So that's something that I started telling people about. I mean, the studies aren't, they're not amazing, but I think the evidence is pretty strong, and study is ongoing there. So I would encourage patients to fast going into their chemotherapy. An ideal situation would be to like a 3 to 5 day fast, a day or two before your chemo, during your chemo, and then a day or two after your chemo. And then your body's already in apoptosis. You get the chemo, and the chemo's that much more effective. So, and here we do have there are some fasting mimicking diets that you can take, so you're not eating anything for a few days, or you can be consuming, but your body's still in that fasting state. So that's something that I recommend, and I think is very underutilized here.
Well, thank you for sharing. What are some common misconceptions about functional medicine that you think most professionals or even patients need to unlearn?
Yeah. Right now I'm really diving into hormones, like I said, with my new job. And I was always kind of under the impression, I think a lot of healthcare providers are, that hormones are harmful, that they cause cancer. And a lot of that is based on poor data from the Women's Health Initiative and other studies that were pretty poorly done. Um, and I think that just a lot of people believe that hormones cause cancer. Um, and while they can feed certain cancers, the risks are pretty low. And a lot of the studies were with synthetic hormones and not bioidentical hormones. So um, a lot of the research that I'm seeing says that hormones are actually very beneficial. They can prevent cancer. They prevent heart disease. They prevent so many symptoms, so many diseases and illnesses, and they're really underutilized since the Women's Health Initiative. So that's probably the biggest one I would say right now is, especially women in menopause or perimenopause. Hormones are actually very more beneficial than they are harmful, and we need to relook and relearn that, and actually look at the data Um,
Thank you for that perspective. And also, as you were saying before, I think this whole conversation actually connects us directly to a broader question of education, not just for patients, but also for health professionals. So let's talk about what's needed to build a future where this kind of care becomes a norm. And not just something that you have to go look for yourself and have to explore alone. And well, finally, I found lifestyle medicine. What kind of training or mindset shift do you think pharmacists need to embrace this broader role?
yeah, that's a great question. I I would love to see it. Um, it should be more of the curriculum. It should be taught in schools. I did take one class about lifestyle medicine, but the hard thing when I was in pharmacy school was that was kind of an easier class, and you have harder classes, and you just didn't really put the energy into it. So um, I would love to see it be more emphasized in class. There aren't a lot of practices either. So when you think about rotations or residencies, I don't think that we were really exposed to that. So as more functional medicine clinics or pharmacies are popping up, they it's probably on them to get more involved in taking on students and educating them. Because yeah, it does seem like there's actually a big movement here that I've seen as I've trained. There are a lot of pharmacists who are feeling burnout, or they actually, most of them have personal health issues, and then they find for functional medicine, maybe for them or for a family member. But there's actually a big movement, people hungry for it and waking up to it. And there are organizations that are pretty good here. One that I've been involved is the Functional Medicine Pharmacists Association, and that's growing, even worldwide. Pharmacists all over can join that and learn. But yeah, I guess it's on us who are awake to it to spread the word and to teach and to help others learn about it, which is kind of why I'm trying to be more vocal online and just write about my experience and talk about it and just connect with others. And I've actually been able to connect with a lot of people through doing that. So yeah, I think just continuing to talk about it and learn about it and be passionate about it and just look for opportunities to share it and to spread it. I guess. I don't know.
No, I completely agree. We are doing the same at ESLO. We are trying to raise awareness for this topic that is so huge and so impactful. So thank you for helping also the this goal. Looking ahead, what role do you envision for pharmacists in the future of integrative cancer care?
That's a great question. I think I'd love to see pharmacists um, just continue to learn, to grow, um, to really look into lifestyle medicine. I think sometimes it some pharmacists, I think some of the training gives it a little bit of a bad rap, doesn't really give it the importance that it needs. I think a lot of the time as pharmacists, we think that medications are the answer to everything, that medications will heal us, that they will, that it's what we need. I don't know if that's our training or if it's just what we do, right? It's what we focus on so much. So um, I think that we need to open our minds and realize that medicines are not the answer. And that's kind of what I realized over years and years of doing it was these people weren't getting better. They were just getting on new meds or, continuing these meds forever. They weren't getting better. So we need to do more research. We need to, and I would love to focus more money and research to studying fasting and cancer and exercise and cancer and things. It's hard because there's not the funding that you get from a new drug, right? to put on a big study. So I would love to have more opportunities to study these things and to practice them. And I know at least here in the US, like the NIH is kind of moving that way. People are talking about it at least right now. And hopefully some of that funding will go towards these studies so that we can learn and grow in that area and not just focus on the pharmaceuticals.
Thank you for that inspiring perspective. And before we wrap up, I would love to ask you an insightful perspective also, but more direct to patients and kind of a motivational perspective or insight, if you have one.
So my message would just be your lifestyle is one of the most powerful things to your health. Your diet, your exercise, your hormones, your stress, your sleep, all of those things are just as effective or even more effective than any medication. So I would just take your own health into your own hands, invest in your health, invest in educating yourself about a healthy diet, about exercise, about everything, and put in the effort, because our health is an investment that you should make. And as you invest in your health, you will be healthier, much more healthier than you will if you just rely on medicine or doctors to give you all the answers.
Thank you so much for this conversation, Tyler, and for sharing your expertise and your perspectives with us today. It's been a truly enriching conversation.
Thank you so much, Raquel.
And for anyone listening who wants to take the next step, don't forget to check out our free ebook. And as always, at the European School of Lifestyle Oncology, we are here to support professionals like you in building that future. Thank you.